Hi, my name is Bernard Williams, and I will be presenting today on the effects of physical activity and exercise on cognitive and brain functions in older adults with dementia. This is for the course Intro to Pathology, PTA 116401. The instructor is Jason Doherty. So what is dementia? In my research, to my surprise, I found that dementia is not a specific disease, but a term that describes a range of symptoms resulting in the decline of mental abilities that eventually severely affect an individual's ability to fulfill their daily activities. Just some of the realities of aging, which we all stare in the face each and every day, is a decline in neuromuscular response, or the nerve conduction of reactions from the brain to the musculoskeletal system, a decline in musculoskeletal strength. We get weaker as we get older. A decrease in cognitive abilities, which we'll be discussing more heavily in this presentation. And because of the decline in these things, there's a decrease in balance and kinesthetic awareness, which we call proprioception. Additional considerations with aging are an increase in precautions or contraindications to physical exercise due to an increase in frailty or potential for injury, which very often are a result of the things that were just mentioned. Some of the specific effects of aging on the brain. There was a 0.35% decrease in brain volume annually in adults after the age of 50, as compared to 0.12% in younger adults, according to the research that I reviewed. Ventricular dilation, or the narrowing of blood vessels, can increase by 4.25% annually after the age of 70, as compared to 0.43% in younger adults. The hippocampus, which plays a major role in memory, can decrease in size by an annual rate of 0.86% from age 26 to 50, by 1.18% from ages 50 through 70, and from ages 70 through 82 at a rate of 1.85% annually. Some of the benefits of exercise are cardiopulmonary health, improvement in skeletal muscular strength. By improving this, we slow the process of atrophy as we age, as well as improved balance and proprioception. This presentation, as stated before, will introduce some of the research being done to determine the true benefit, if any, that exercise plays in the role of patients with dementia. Some information through research and studies that I reviewed. A report from the Alzheimer's Association shows that 13% of adults 65 and older and 43% of adults age 85 and older have Alzheimer's, which is a form of dementia. A study by Y.E. Gata et al. Showed that moderate activity during midlife was associated with a 39% decrease in developing cognitive impairment and a 32% decrease in late life. A study by J.M. Burns et al. Found an association between improved cardiopulmonary fitness and neurophysiological improvement. The study also showed less brain atrophy in early Alzheimer's patients. Things that had no bearing on these results were age, sex, the severity of the dementia, or physical frailty. Continuing with the research and studies, several longitudinal studies that I reviewed, one showing that older adults who have participated in physical activity show less cognitive decline over a 2 to 10 year period. In a longitudinal study conducted by Barnes et al., the effect of cardiorespiratory fitness on working memory, processing speed, attention, and general mental function was measured, again in the study by Barnes et al. In this study, subjects were 50 years or older from across 11 countries. And the study showed that individuals who participated in regular physical activity, particularly those who engage in vigorous activities at least once a week, showed less cognitive decline after a 2.5 year review period. In conclusion, The research showed that physical activity has physical and cognitive benefits. The studies show that physical activity, particularly cardio fitness, does well in helping to prevent dementia as well as improve symptoms in those who are in the early, mid, and even late stages of the pathology. In patients with dementia, physical activity helps to improve mental, processing speed, memory, and executive functions. Again, mental processing speed, memory, and executive functions were all improved by physical activity. My assessment of the research. I feel that the research is validated because of the many research studies that I reviewed and how each of them showed a consistency in the fact that physical activity, particularly cardio fitness, improved mental function on a number of levels. The research showed longitudinal and intervention studies, also controlled and uncontrolled research studies, and I can appreciate the impact exercise appears to have on the neurophysiological function due to the connection between the brain and the kinematic responsiveness of our bodies. Exercise improves strength, balance, and proprioception, and our mind is the control center for all of those things. I believe the role that physical therapy plays in assisting older adults with this pathology is that we have to have an understanding of the physical and neurological components of the human body and their synergistic relationship in overall health. I believe physical therapy plays a key role in reducing the risk of cognitive decline in early and midlife adults and can help improve cognitive function in older adults with this pathology because of this knowledge. Thank you.